Hi, I'm Trisha Gibson. Welcome to Choosing Recovery. Today I have back on the show Sheriff Keith Wood and Major Scott Trussell of the Meigs County Sheriff's Office. We had them on 2 months ago discussing the problem of substance abuse in the county and how it relates to law enforcement. Today we wanted to have them on to talk about costs to the community associated with substance use and how that relates to law enforcement and other areas in our community. Before we get started with the interview, I wanted to read some data. This is from Meigs County specifically. This was published by the Meigs County Health Department. It can be found on their website, which is meigs-health.com. In 2015, they completed a health indicator survey, and it showed that residents indicated that poor health decisions, such as taking illegal drugs, are the largest health concern impacting the community in Meigs County. Nearly 2/3 indicated that drug and alcohol abuse is a primary problem in the community, and only 1/3 of those respondents knew where to get assistance for drugs or alcohol-related issues. And that's pretty low numbers. Nearly 1/3 indicated stigma against seeking mental health or addiction treatment was one deterrent from seeking treatment and getting the help they need. In the 1970s, we experienced the deinstitutionalization movement. A lot of our state facilities were shutting down, so we didn't have mental health inpatient asylums, they used to call them. So now, really, sheriff and major jails and prisons are the new asylums. And that's kind of what we're seeing. I'm curious to see, the statistics I stated, I feel like we're really seeing that in the jail population. These people don't know where to get help or aren't seeking treatment, so they're ending up in your jail.
Yes, absolutely. It's staggering where those numbers have went the last few years. I mean, we're continually battling with this problem in our communities, and it lands on our doorsteps. And the majority of our issues that we have in our facilities is related to drug, alcohol issues. And so the biggest problem we face that is mainly our facility we have is a very old facility, so it's more difficult for us than some counties have.
Can you give me like an estimate, like how many arrests in the last year, just on average, off the top of your head, would have been related to drugs or alcohol?
Oh my land, it would be easily 70–80%.
I'd say 85%.
I mean, high number, very high number.
Yeah.
Yeah.
High. Would the other 15% be just criminal behavior that people normally think of, or would it be related to mental health? Maybe
I think
both?
that some of it would be property crimes, but again, the property crimes usually goes back to the drug dependency. And then the mental health, there is a substantial number that whenever, we've talked about before, whenever you have drug dependency, you're going to have dual diagnosis and you're going to have mental health issues. A lot of the people that we get in our facility that are drug dependent, we have Hopewell come in and do evaluations and work with those people because of that issue, and it's going on daily with the inmates that are there, pretrial felons, and we have Hopewell coming in twice a week to see the inmates we have down at our facility and at another facility down the road. So, but yeah, the mental health issue, we see a tremendous increase in that.
I think too, and what you're saying, Major, is the link that you can even go back to the schools, like the crimes within the schools with the kids, whether it's directly related to a mental health issue or some cyberbullying on texting or social media. Everything links sometimes back to some mental health issues that that lands back on us too. I mean, we're dealing with this in a very large scale. I mean, most everything links back to some kind of, I mean, I can think of recently we had a person that came in and served a DUI jail sentence. That's one of the rarest ones we see. I mean, but it was alcohol related, but still, I mean, for us to end up with people, what we have in our facility right now, we can link a lot of them up back to the drug dependency.
Right. Okay. And it's not like you're housing misdemeanor or low-level offenders. You
No.
you only house felony offenders at the
Generally,
Meigs jail.
yes. Very rarely do we have misdemeanor inmates that's in there. I mean, usually it's something related to felony. A rare occasion, like I said, with the DUI offense, that person had to serve some time out for 2 or 3 days by the court order, but it's just things that doesn't happen that often.
Mm-hmm. I also want to highlight, in those statistics from the Meigs County Health Department survey, Meigs County had twice the overdose rate of the United States average of overdose rates. That's pretty serious, and it sounds like we as a community really need to start doing something to address this.
Exactly.
And we're seeing these people in jails now.
We deal with this every day. It's an everyday issue with us, with something related to drugs. If my guys aren't bringing something into the office that's drug related or an arrest on drugs, they're sitting at McDonald's and wasting time because it's out there continuously. I mean, this problem is completely out of control, and we're trying to battle it by enforcement, but that's not the total solution to this. We have to find other avenues and sources of how you correct or fix this problem besides arresting everybody. Arresting is a necessity, but and getting the drugs off the streets, but when these people come back into our facilities time and time again, and what have they gained from what they went through the system of corrections, what did they gain from that? Mm-hmm. So there has to be other ways that we accomplish this besides looking at it as, it's not my problem, I don't want to worry about it, I don't deal with it. This is a community problem. Yeah. It's in everybody's backyards.
Yeah. I particularly have problems when people say those people, those addicts, those criminals. And I think that people forget that they're human beings.
Yeah, it's family, neighbors, friends. I mean, we have a lot of issues that people are coming into our office and asking for help for their grandson or their daughter or their son, and we try to find them direction with what resources we do have, but many times there's just not that avenue or that path that they need to be on. And you know, we've got a pretty good plan that we're working on right now with the future, whether it's in a new facility or we stay in our old facility. But we've got some ideas that we have to be on a different path. Mm-hmm. But it takes community involvement to change those things.
Absolutely. Tell me about your existing jail. When was it built? What's it like inside?
It's an old building. It was a residence built for the sheriff back in 1894. It was designed to hold at that time 20 plus inmates. It had some areas in it for mental health issues. Even back in those days, you think about, well, they was dealing with it too, and areas for alcohol problems. And so it's an old building. It's got a lot of issues to it, deterioration, age, and just being able to generally do our jobs there. Times have changed for us. Technology has changed, and the manpower that we need to take care of things, it's struggling for us to keep that old building going, but we try.
How many inmates can you hold in that jail?
We're allowed to hold 5 people now, 5 male for 12 days. So it's a 12-day holding facility. We have jail inspections. We're getting ready to have one here coming up by the state here in a few weeks, and we never pass that standard to. We just can't. The facility just isn't able to accomplish any type of passing of a inspection we get. We're able to just keep it going for the 5. It would take a major renovation to go in there and to fix it up to hold 5 people. It would cost a lot of money to do that.
So you can hold 5 inmates for 12 days. What happens on the 13th day if they're still incarcerated?
We have to move them out. We have to put them into a full service facility, which means we got to travel all across the state of Ohio. We drive them to Toledo, to Bucyrus and Crawford County, out to Butler County, Monroe County, Stark County, and all points in between. We have to find room for a person that's incarcerated, we basically have a list that we go down. Just a week and a half ago, we had a female that we had to find room for, and we checked 31 jails in the state of Ohio, and nobody had room for any females. As a matter of fact, one county I called said they turned the county adjacent to them away for 13 because they were trying to lock 13 females up, and there's no room. And the sheriff actually contacted another sheriff in Crawford County and asked if he could help him out, and we were able to put that female up there. And it's a very serious charge, and it's drug related too. And so by that means our deputies are leaving the county, transporting inmates all over the state. In 2017, we drove 36,000 miles just hauling inmates to facilities to hold them, because our 5 people in there, 5 days, jail standard says we got to move them out, because they have to, after 14 days, they got to have a full medical evaluation. So abiding by the guidelines set down by the Bureau of Adult Detention, we hold them for 12 days, and they want us to basically put them out to a full service facility.
And the unfortunate part of that is when you look at our community, and we have, our jobs is to protect and serve the community, and we're on the road traveling, and so this epidemic has created a situation where my guys are traveling all over the state to haul prisoners, and no one's there to look out for the county sometimes. I mean, it's not a good situation, because it leaves us traveling, very vulnerable. And so we have to look at how can we do that better? And what we've done on this particular project that we're looking at is we've looked at what other counties have done across the state. We've looked at Shelby County, Mercer County. They have very good plans that they implemented several years ago, and it's working for them. They're actually generating very positive things out of it. They're trying to get people back on track in their lives, because these are people that are going to still live in your community, and they're going to come back. If they're going to prison, they're going to come back someday. So let's try to figure out that avenue that stair steps them back to us. Shelby County's got a perfect plan, and I've been meeting with the sheriff quite a bit on this, and I met with him last night, and today we've talked about things with plans that he does. You don't have to create a wheel to make it roll. I mean, if there's one there, get it out there and go with it. We're a small county. Shelby County is a small county too. They're less than 50,000 people, and they have 14 full-time officers working. We have 23,000 people, and we have 15 officers working full-time. But you can't keep them on the road all the time and keep trying to look out for the safety of your community and still try to figure out how you help these folks that are having problems. And so the plans...
It's a revolving door,
It is.
right?
It's just a continual revolving door. And it costs us a lot of money.
Without some kind of intervention.
We're spending about average around $300,000 a year for outside housing that we do, and that's not counting our transportation, man hours to do this. But build something that is reasonably cost. It's an investment for your community. It's an investment for your future of your kids and grandkids. But that's what we're trying to do. We're not trying to create a burden on anybody. We already got the burden in our laps. We just got to figure out how we can do it ourselves and take care of it.
Give us an idea of, like, so probably today you have 5 males at the jail. How many are booked in through the sheriff's office total?
I didn't count the ones we had today, but the last time I checked on the roster on Friday, this past Friday, we had 24 people incarcerated. We had the 5 males in our jail, and the rest of them were housed all over the state of Ohio. As a matter of fact, on Friday, we had 11 females in custody, and that's probably the most we've had for quite some time.
And these places are 3 and 4 hours away, just depending.
Yeah.
One way.
Oh, yeah.
One way,
trip.
3.5 hours. So in an 8-hour shift, our deputy is gone. By the time you drive the 3.5 hours, and then you take a half an hour, 45 minutes at that facility doing the book-in process, and that person gets back in the cruiser to start heading back down the road. So that pretty well takes up the whole 8-hour shift. So if we have 2 guys on the road, covering the county and one's in a vehicle traveling the entire shift, we got one deputy handling all the calls in the county.
A lot of liability involved in that too. We have people that's traveling, like I said, all over the state, and you have liability issues of hauling these people there to and from, just the general traveling of having an inmate in a car if you're in an accident or something. But there has to be a better way that we can take care of ourselves. In our community, we've asked our community to step up to the plate with this one to help us create some ideas, recovery services. We've met with those folks to implement ideas into our project that gives that opportunity and some hope for folks that's coming out, to give them a general purpose to be able to get back to the streets. I mean, how we're doing it now, they walk back to the streets and they're not, I mean, there's just not a thing that's keeping them from going back to their friends. I mean, that's what the part is, that we've got to try to prevent that. Get them back into, maybe, I know the sheriff yesterday told us that last year in their facility they handed out 38 GEDs to inmates that they're working with. They're trying to get people back on that path of life, and if most people in our communities has someone or they know someone that's affected by this problem.
Absolutely.
And I do. I have a person in my family that has issues with this, and it's disheartening to know of how we're doing it now, that we should be doing it a whole lot different.
There's nothing following. Right now there's no services following any of those inmates that would get out on a bond. There's no services following them to get them the help they need to stay clean. So when they go out the door on a release, they're going right back into the same life they were living that put them in the jail in the first place.
Right.
So there's nothing benefiting them, and
again, it's a repetitive cycle because they're not having any interventions to help with sobriety and recovery.
In 2016, of the 160 people that was on probation or community control through the Common Pleas Court, we received 80 of those back in probation violations that we had to lock back up.
So reoffense rates are pretty high.
Over half, yeah.
Quickly, and very quickly, normally. And we've had several cases where they've got released on like a Friday to go back to on probation, and by Monday or Tuesday they have died. We've had some that died of an overdose, and so you're losing people. You know, human beings. They're struggling. They're trying to. And no matter how we look at this situation, it could affect any of us in our family or ourselves.
It could be anybody.
Absolutely.
Any of us.
It keeps getting worse with this. Right now we're starting to hear a lot of things about fentanyl coming in, and just the fact of contact with fentanyl. We've seen officers that's went down in law enforcement field to have Narcan to bring them back. So we have to figure out what's. I mean, it is a health concern for our communities. It really, truly is.
It really is. Speaking of healthcare related costs, so does your jail inspection or regulations from the state, like, have you have healthcare as part of your services in the jail?
There's a standard in the jail minimum standards that the state has put out through the Bureau of Adult Detention that is all is medical. And they have certain standards. There's actually, it's probably the largest standards section that they're listed as essential, that you have to meet at 100%. And when it comes to the medical, I know that the sheriff's budget, the commissioner's budget, around $20,000 for medical for the inmates. Last year we spent over $50,000 just in that medical line item. When the sheriff is in charge in the jail for the care, custody, control of all the inmates that he has. And based on that, if they come in with, let's say for instance, their teeth being very bad shape for methamphetamine abuse. So what happens is we have to go get them antibiotics to get the infection down. Then we have to actually have the tooth pulled, and we have to take care of that. And any kind of medical, when it comes to the health care, when these folks are out, they're not getting the health care when they're addicted to whatever drug that they're on. They're not getting their health care, so when they get incarcerated, guess who's responsible for that?
Then all those things hit because they're not using substances, obviously, in the jail.
And then when even the mental health, because if they were on mental health medication before, they're not taking that medication when they're out, but just as soon as they get incarcerated again, then we have to take care of getting all their medical needs taken care of. We got to get their mental health needs associated and talk with a counselor to start that. And it's a lot of responsibility for us that we're in charge of taking care of, and we do, but it's a cost. And who's it a cost to? It's the cost to the sheriff's budget, but where does it actually boil back down to? The taxpayers in the county. They have to have that budget to take care of these folks.
Sure.
You know, the thing of it is that's interesting about this is if you think back what you're talking about, like the institutions years ago, but we used to, when I first started in law enforcement, we took people to Athens. They went to Athens to the state hospital, and it was just like a drop-off point for us. And I look back at that and how we did it, it was like those people really didn't get what they needed. I think that sometimes what changed for us in law enforcement was just the whole culture of this thing, how it's taken off. For me in the last 6 years to see this as sheriff, it's astounding. I mean, it's just totally astounding. And I don't understand how and where we're going to be 10 years from now. We were at the Drug Coalition meeting yesterday in Meigs, and the question came around and was how do you want to be looking 10 years from now in your status as a sheriff or in the mental health recovery programs? And it was some interesting numbers that come out of that. There was numbers that said we should be we shouldn't have a drug problem anymore. But what I want to be able to look back and when 2028 comes is I want to be able to say to the kids that look at what we did back in 2018, they did try to make a difference. I mean, I think that's the most important thing of a message, that what's our future generations going to look back at us, what we tried to do. Did we ignore it? Did we just try to let it keep going? You know,
Yeah, I feel like we all have a duty to try
there
to
is.
step up
There's just
and
an
address this.
absolute duty to this whole thing for every one of us. I mean, the answer is in the mirror. You have to look in the mirror and say, I am part of the answer to this solution. So,
and you know, it's just not our responsibility to take care of this. It's every person that lives in Meigs County, and I talked to the sheriff the other day. It's what's your contribution to the county to help out the county?
we all have to contribute to that.
Everybody has to contribute. Not one person, not one group of people is going to solve this. It has to be a community-oriented fix. That means everybody's got to step up and everybody's got to put their hand in it and say, let's fix this.
This is a public health crisis. It's serious.
It
That's
sure
where we're
is.
at today.
It sure is, Trish. Yeah.
One question. We could talk for days, I'm sure. Unfortunately, we only have about 30 minutes. The public view, I think the public wants to see drug dealers and drug addicts locked up. They want them in jail. They want them in prison. But what do you do with those people? Are we, as a community, setting you up for failure, or are we asking you to do something that's unattainable?
Well, I mean, my opinion, and I'll let Scott share his real quick, but mine's real short. To me, the answer for those type of issues is where do you go from this point if you don't try to come up with answers together, and you have to do that together, you can't continue the way we're doing it. One way that we're looking at right now is we have a project that's incorporated with this facility, is when they come out of prison, they come back to our facility. Shelby County has it, they come back for 3 months. They're going to get released back to community 3 months. And then at that point, they graduate like in a 6-month period, but they're putting them out into work environments. They're working with Job and Family Services, they're working with giving them ideas besides their life of what they're into.
Sure.
You have to have that plan.
So thank you, Sheriff Wood and Major Trussell, for coming on again today and sharing just the issues that you're up against and telling us what it costs to address this issue of substance
Every
abuse in
community's
the
facing
community.
this, that's for sure.
It really is.
Yeah.
I wanted to give a quick shout out to Perkins Community TV viewers from Youngstown and also Anderson Community TV viewers in Cincinnati. Thanks for watching today. We'll see you next time.